Good evening, everyone, and welcome to week 9. So let's go into our coursework and jump right in, see what we're going to be doing this week. All right, everybody's been doing a great job, and gosh, we're rapidly coming to the end of our time together. And what's important is your exam. So we've got the final coming up, and week 12. And I have had some students request that the final update be done a little sooner. So I am looking at my schedule and I'll get back to you as soon as I come up with a date. I don't want it to be too soon, but yet I don't want it to be too late either. So I'll get that out to you within the next day or two. So let's look at week 9. We have our reflection and the overview of the week. So, women's health doesn't stop with reproductive health or health care during pregnancy. In order to maintain good reproductive and sexual health, girls should have access to care that's focused on their female gender. Now, usually we say that women should begin seeing a gynecologist at the age of 21, regardless of when sexual activity begins. That's different. It used to be that once you became sexually active, you should be seen by a gynecologist, but now they say 21. At the ages 21 to 29, women should have gynecologic care annually with a pap smear. Women between the ages of 30 to 64 should have routine gyne care every other year. And now they say that if you have had a negative pap smear, you can go 3 years. Each exam includes a sexual history, menstrual cycle review, physical examination of the breasts, genitals, pelvics, all of those things. So, here are our objectives, and I'm sure at this point you have had opportunities in your clinical setting to do pelvic exams. So, here's some information on that. We've got some PowerPoints, female pelvic exam, and a bimanual exam, and then we have our clinical rounds discussion. I think you did a wonderful job on your clinical rounds discussion. Take heed to the notes that I made in regard to tightening up your focus note a little bit. Some of you expanded on a little more than you needed to, and not that that's a bad thing. Also, ensuring that you are going in a good cohesive order, that you're following all areas that need to be followed. And one of the important things, too, is that when you're doing these exams, I want you to do it like you've got to cover all the bases because you've got to practice. Every time you have an opportunity to practice, you've got to practice. So remember, your chief complaint are the one or two words that's going to guide your visit. So, what brought the patient in to see you today? And this is applicable whether you're in women's health, pediatrics, adult health, whichever. That's what your CC is. Your HPI then expands on it. So, all information in your HPI should be related to that chief complaint. So you don't need to put things that belong in other pieces of the history in that HPI. Then you'll move on and um, get some of that social background. So I want to know if there's any past medical history. Past medical history includes, oh, I have Crohn's disease, or I have asthma, or I have whatever. And then your surgical history is going to be next. Family history. Do you have any family history of chronic disease or illness? And that does, is there any cancer, hypertension? Sometimes you need to explain to your patients what you mean by that. Are there any allergies? I'm talking about allergies, I want to know if there are any allergies to um, environmental, food, or medical. Medications, a list of the medications that the patient is taking, and I want to know if they're on any herbal supplements. That's important information to know too. Social history. Do you smoke? Do you exercise? Do you drink alcohol? If so, how many alcoholic drinks do you have per week? Now, in this um, course, you're going to have another section that you aren't necessarily going to have in other courses. Now, Anytime you are dealing with a female patient, it's important to know when their last menstrual period was. Are you on any birth control? Are your periods regular? Is there any risk of pregnancy? Because that may um, it may interfere with medications that you wanted to prescribe and things like that. In this course, it's more important. So we give it its own title, reproductive health. So with reproductive health, I want to know when the last period was, how many days between periods, are their periods heavy, are there any clots, are you sexually active, how many sexual partners do you have, any history of sexually transmitted infections, when was your last pap test, and what was there were there any abnormalities to it? Are you heterosexual or bisexual, or are you gay? So all of those things, anything that encompasses that reproductive health goes into that separate little area. So reproductive health is something that you're going to stress on in this area or this course where you aren't, it's always important, but you're going to focus on that a little bit more in this coursework. Then you go into your review of systems. Your review of systems again. So we're in that subjective area. Subjective comes from the patient. So anything that is subjective, we are not visualizing at the time. It's what the patient tells us. So you want to keep that clear. In your review of systems in a focused assessment, you're going to make comment on those systems that are impacted by the chief complaint and the history of present illness. So only those two areas will dictate what gets discussed in the review of systems. Now, let's go on to now our objective piece. And with our objective piece, we're going into the physical exam that we do. Now, do we do a head to toe physical exam on every one of our patients? No, absolutely not. But we are going to do uh, examination of the body systems that have been discussed in the CC, the HPI, and the review of systems. So those areas, those three areas, are going to dictate how we perform our physical exam, and we definitely are going to make mention of any negative or positive findings in those systems. Now, you'll find this in other courses that you do too. So I tell my students that I work with that when we have a pediatric patient or we have a sick visit, that if you've made mention of a body system in either the CC, the HPI, or the review of systems, you have to have something about it in the physical exam. So I'll give you an example. If I have a patient who comes in to my clinic with a complaint of sore throat, but they also have the complaint of a headache and a stomach ache, when I'm doing the physical exam, I have to have physical exam of their neurosystem and of their abdomen as well as their sore throat. So anything that is mentioned or touched on in the CC or the HPI, you need to then comment it on the review of systems and then again in your physical assessment. And then the rest you're doing pretty well on. Make sure that you have differential diagnoses, at least 3 to 5, and that you are utilizing ICD-10 codes for those diagnoses. I also want you to really focus on patient education. And then I want you to educate us on the topic that you've chosen. And as I said, you did a wonderful job last week, and I'm sure you're going to do a great job this week too. Just be mindful, this is not the time for you to be discussing normal patients. Now, the exception is you have a patient that comes in for a normal exam and something abnormal is discovered on the exam. Then you can certainly write about that, but not just your normal, typical patient that comes in for an annual exam without any issues attached to them. Okay? Have a wonderful week.